Hi, my name is Christine Rayfield, and this is my return skills demonstration for tracheostomy care and suctioning for NR224. All right, I'm knocking on the patient's door. Good afternoon, Mrs. Smith. How are you doing? Good. I'm going to close this door behind me so we can provide privacy. I'm placing my supplies on a clean surface. All right, first thing I'd like to do is verify your identity looking at your bracelet. Can you say your name and date of birth? All right, wonderful. So I am here because your doctor put in a order to do some tracheostomy care and some suctioning. I'm going to perform some hand hygiene, and I'm going to go over that procedure a little bit with you. So what we're doing is we're going to replace a part of your tracheostomy, and then we're also going to clean the area around the site, and we're also going to suction out any secretions or mucus that may be down in your trachea. All of this is just to help you breathe better, keep your lungs functioning the way that they need to be, and then also avoid infection from occurring. Do you have any questions before we get started? And do I have your verbal consent to perform the tracheostomy care and the suctioning? All right, wonderful. So right now I'm going to raise the bed to the level of my hips, and then I'm going to sit the patient up into semi-Fowler's or Fowler's position. All right, and then I'm going to listen to some lung sounds using my diaphragm. Listening to lung sounds. All right, and I would listen to posterior lung sounds as well. And due to what I'm hearing, you could use some suctioning, so it's a good thing we're getting that taken care of today. All right, so I'm going to perform hand hygiene. I'm going to increase the supplemental oxygen flow per facility policy for hyperoxygenation protocol. And then I'm going to perform hand hygiene at this time. All right, I'm going to prepare my suction catheter kit. I'm going to bring that over here and open that. I'm going to put my sterile gloves over here. And then at this time, I'm going to make sure I'm not touching anything else in my kit, but I'm going to remove this little container for my sterile water. I'm going to make sure that I only touch the outside of this container, not the inside. So the inside is sterile, the outside is not. I'm going to place that down, and then I would open up some sterile water and pour that into the container at this time and replace the cap and set that down. And I'm going to don sterile gloves. To coil the catheter around my dominant hand, which is my right hand. So my right hand is going to stay sterile. My left hand, I'm going to turn on the suction device and make sure that the regulator is between 100 and 120 millimeters per mercury. I'm also going to connect the suction tubing to the catheter connector. So I'm going to hold on to the non-sterile end on this side, and then I'm going to place my tip of my suction into the sterile water to flush the line and also moisten for insertion. Hold onto the sterile side with my dominant hand and remove the trach mask. And I'm going to insert with my dominant hand. I'm going to insert until I meet resistance, and I just did, and then I'm going to withdraw half an inch and then intermittently suction while I rotate the catheter as I remove it from the tracheostomy. And I would make sure that each pass is no longer than 10 to 15 seconds. So I'm going to put the trach mask back onto the tracheostomy, and then I'm going to flush the line again and clean it, and then I'm assessing my patient's respiratory rate, their skin tone, and their pulse ox. Everything is within normal limits, so I'm going to do another suction pass. So I'm taking off the trach mask again. I'm entering the tracheostomy site. I met with resistance and removed a half an inch, and I'm rotating while I intermittently suction. And then I put the trach mask back on, And again, I'm assessing the respiratory rate, the skin tone, and the pulse ox. Everything is good. So I'm going to disconnect the catheter from the tubing, and I'm going to discard of the tubing for that. And I'm also going to turn off the regulator, the suction device. So discard that into the proper trash receptacle. At this time, I'm going to remove the dressing that's around this, the outer cannula. So I remove that, and I'm assessing it for color, consistency, odor, and the amount. Everything looks normal. I'm not seeing any signs of infection at this area, so I'm discarding of that, as well as the suctioning tubing that was connected to the suction device. I'm going to remove that, discard of that, as well as my gloves. I'm going to perform hand hygiene. And then I'm going to go over to my tracheostomy care kit and open that. I'm going to remove this patient drape and place it on the patient's chest so we can protect their clothing in case we have any splatter. I'm also going to use that sterile water and open it, and then I'm going to discard a little bit out of the top since I've already used this sterile water, and then I'm also going to pour it back into this little area where my drape was. So I pour my water, replace the cap, put it down, and now I'm going to put on some new sterile gloves. Alright, and so I'm going to stick my sterile cotton tip applicators into the sterile water to pre-moisten them, as well as 2 pieces of gauze. And then I'm going to leave some dry gauze in there to dry the area when I'm done cleaning it. I'm going to remove the trach mask, and then with my non-dominant hand, which is my left, I'm going to remove the inner cannula, remove that, and then I'm going to discard of that in the proper trash receptacle. And then I would take the new inner cannula that's in my trach kit, and I would put it in, so I would follow the curvature, and I would turn it into the locked position and make sure that it was secure. So it's secure right now. At this time, I'm going to start cleaning the outer cannula and the tracheostomy site. So I will use the sterile cotton tip applicators, and I'm going to use circular motions, and I'm going to move away from the stoma site. And discard of that. Use my other one for the other. Discard of that. Going to squeeze out any extra water off of this gauze and use that as well to clean the site. Discard of that, and then again with another piece. And discard of that. So now I'm going to dry the area with dry gauze. I'm going to pat it dry. Discard. Pat dry. And discard. So now I'm going to replace that fenestrated dressing underneath the outer cannula. So I'm going to hold onto the tracheostomy tubing to keep it secure. I'm going to use my dominant hand to place the new fenestrated dressing. It's a little difficult. Okay. Good. So at this time, I would put the trach mask back on so that the patient has some oxygen. And then I'm going to discard of all of my supplies. I'm sorry, not yet. I'm not going to discard. I have to replace the ties. So I would leave the old ties on until I properly tied the new ties on. So I'm going to go through the outer cannula and then make sure that it meets like this. And then I would wrap it around the patient's head and make sure that it wasn't twisted anywhere. It doesn't quite fit, so I'm just going to pretend like I'm going around. And then I would meet to the other side where the other side of the outer cannula, slide it into that little slit, and then make a square knot. And then make sure that there was enough slack for 2 of my fingers to fit underneath of the new ties. So my new ties are secure. I'm going to pretend like this is my old tie, so I am removing that, and I'm going to discard of all of my supplies. Discard of all of that. I'm going to remove my gloves. I'm also going to remove PPE that I had on. I had protective eyewear, and then I also had protective mask on. So I'm removing my PPE. discarding of that, I'm going to perform hand hygiene. And now at this time, I'm going to auscultate lung sounds again. Alright, and then I would also do the posterior lung sounds again. That's sounding much better this time. So it sounds like we got that secretion out. Now I'm going to turn the oxygen back down to the prescribed amount. I'm going to perform hand hygiene again. Lower the bed to the lowest position. I'm going to make sure that the bed rail is up and that the wheels are locked. The bed call light is within reach. Alright, Mrs. Smith, is there anything I can do for you before I leave? Alright, if you do need anything, just press your call light and we'll come and check on you, okay? Alright, thank you. And then I'm going to perform hand hygiene as I leave the room.